presented by Casey Curry, Amanda Fremo, and Tiffany Robinson. In this presentation, we will be reviewing a case study regarding a woman named Felicity. We will then be answering questions pertaining to the case study along with providing content to provide information and why. Let's first look at what a teratogenic agent is. Embryonic abnormalities can be caused by many different things, such as physical agents like radiation, chemical agents such as drugs. A common or well-known teratogenic agent is called thalidomide or alcohol, or biological agents such as infectious agents like rubella. Nutrient deficiencies also have the ability to cause embryonic abnormalities, such as folic acid. When there are low levels of folic acid, this can prevent proper neural tube closure and ultimately result in neural tube defects, which is what we will be highlighting in this presentation. Folic acid, folate or vitamin B9 is an essential vitamin, one of 13 essential vitamins. It cannot be created by our body and thus must be consumed either in a dietary folate form, such as through leafy greens, legumes, egg yolks, liver, and citrus fruits, or in supplementation, which is then called folic acid. This supplemental form can be found in fortified grains or in a tablet form. This is best if supplemental doses are taken at 600 milligrams on a daily basis, particularly in certain female populations, those in the preconception period getting ready for pregnancy and making sure everything is taken care of before they can become pregnant, women who are currently pregnant and should continue to take this especially during the first 8 weeks of their pregnancy, as this is when critical neural tube development is occurring, and also women throughout their reproductive age, as you never know when you may become pregnant. Folic acid supplementation has the benefit of reducing neural tube defects by 60 to 70% when taken on a daily basis. Folic acid deficiency and its impact on fetal development. We know that low levels of folic acid cause abnormal closure of the neural tube, and normal closure occurs typically between weeks 3 and 4 of gestation, which is why it's essential to take folic acid earlier on in your pregnancy. We also know that genes are heavily involved in folic acid metabolism, and we know that these genes can cause neural tube predispositions. We'll be looking at neural tube defects, which include anencephaly, spina bifida, and cephalocele. However, we do want to note that there are other types of spinal fusion abnormalities that can occur. Looking at anencephaly as one of the neural tube defects, this occurs, as you can see in the picture, when there is incomplete brain development and an absent part of the cranium. It often causes the head to be triangular shaped. Spina bifida is another type of neural tube defect. This defect occurs in the vertebral dorsal arch or the lower portion of the back, and when there are exposed meninges and spinal cord. There are 3 separate categories for spina bifida. There's spina bifida occulta, which is the mildest form, and there is a gap in the spine, but no sac or opening occurs in this case. There is often a tuft of hair or a dimple in that region of the back. Meningoceal is the middle type of spina bifida, when there is a meningeal sac that has formed outside of the spinal column. However, no spinal cord involvement has occurred. As you can see in the diagram, you can see that sac has formed off of the back, however the cord is still within the spinal column. And myelomeningocele is the most severe type, when there is a herniated meningeal sac that has formed outside the spinal column and the spinal cord is involved outside of the body. Cephalocele is another type of neural tube defect. This occurs when there are herniated meninges in the cranial defect, which is then typed encephalocele. This often occurs in the occipital region or the lower portion of the head, as you can see in the diagram. It is also commonly associated with hydrocephalus when there is fluid in the ventricles of the brain, or in microcephaly when there is a small cranium. We also want to take a look at additional risk factors for Felicity. The case study mentioned that she has diabetes mellitus. This places her at an increased risk for miscarriages and congenital abnormalities due to the possibility of having hyperglycemia, which is high blood sugar levels. As a result of this, we want to make sure that she's having a good target control of her glycemic index every day, which is why she's checking her insulin and potentially taking medication for it on a daily basis. A good way to make sure that she's staying within a good target range is by checking her hemoglobin A1C and hoping that it's below 6% to make sure she is within good control. We'll also want to provide her with counseling regarding estimated fetal weights, particularly if the fetal growth is measuring on the larger side and the baby's weight is estimated to be greater than 4,500 milligrams. Then we will need to discuss potential delivery options for her to make sure that there is a safe delivery for her and her baby.
Okay, hi, this is Tiffany here, and this is my part of the presentation. So the question is, what is the benefit of maternal serum marker testing? And the benefit is that it's a screening tool in order to identify the possibility of the pregnant woman having a baby who has neural tube deficits or trisomy 21, Down syndrome, or trisomy 13 and or 18. So it is not, it doesn't, if it's positive, it doesn't mean that the baby has one of those things. It means that it's a possibility that they do and further testing would be needed. So the most common tests that are done are around 16 to 18 weeks. It could be a triple test or a quadruple test. If it's a triple test, it's the alpha fetoprotein, AFP, much easier to say, or the HCG, or the unconjugated estriol, or those three are the ones that would be done if it was a triple test. If it's a quadruple, they add the inhibin A. If they do it in the first trimester, it's usually the PAP-A, the HCG, the AFP, and then they do a nuchal translucency. And they're looking at the neck of the baby on ultrasound. So AFP, alpha fetoprotein, is a major fetal plasma protein. It's secreted by the yolk sac, the GI tract, and the liver of the baby. It peaks at 10 to 13 weeks, and then it goes down and peaks up again. So in that time frame when they're testing for it, an high level would indicate a possibility of neural tube defects or abdominal wall defects, because it would be leaking into the amniotic fluid and passing through the placenta and detectable in the maternal bloodstream at a high level. Then a higher level than expected, or a really low level would be more consistent with a Down syndrome. HCG is made by the outer layer of the trophoblast after implantation. That's why it's detectable on home pregnancy tests. It has a really rapid rise in the first 8 weeks, and it kind of slows down, still increases, but at a slower rate, and then goes until about 20 weeks, and it plateaus out. A high level of HCG is the highest detection rate for Downs. It was like the first indicator, and now they've added these other ones to even further cement the probability, but that was like the first and foremost test for Downs. Unconjugated estriol is made by the placenta. It's influenced by the fetal adrenals and liver. It increases throughout pregnancy, and the low level is associated with Downs and trisomy 18. Inhibin A is secreted by the corpus luteum and the trophoblast, and it can help, it can indicate the possibility of Downs, but it's also now being used to help predict risk for preeclampsia, which is really interesting. So if the results come back abnormal, there'd be a couple of different things that could be going on. Basically, it's just saying that there is a suspicion of a genetic anomaly. So the chart here shows that if there's a neural tube defect suspected, they would immediately do an ultrasound, because if the gestational age of the baby, like the due date's off, that could be a false positive. So we want to confirm that the baby is at the proper size for gestational age. or maybe the due date is wrong, and so we can do the test again, recalculate, do it at the proper time. If it is baby is confirmed of EGA, then they can either repeat it, do another ultrasound or amniocentesis, and further testing would be referred to a geneticist. So in these ones, if they were suspect, then they would offer an amniocentesis to analyze the chromosomes. So, and of course, all of these tests are optional depending on if the woman would like to do genetic testing. But she may be at increased risk depending on her age, her other medical conditions, his family history of genetic problems, or a child already having had a child that had a genetic problem. What other tests would be particularly useful to monitor the development of this particular young lady, Felicity, in her situation? Well, she has diabetes, and she also was not on any folic acid, so both of those are correlated with neural tube defect, and type 1 diabetes is associated with cardiovascular anomalies. So definitely they would want to be checking her blood sugar multiple times per day, probably. Ultrasounds to monitor growth and to rule out anomalies. Hemoglobin A1C would be indicative. It would tell more of a story about her blood sugar levels, and they would probably do it in each trimester. And there would be certain, usually they want it under 6.5, but in the second trimester of pregnancy, they might be shooting for 6. I mentioned the glucose testing, and then ketones. They could do a blood or urine ketone, which could indicate a decrease in glucose availability. So she's spilling ketones, or it's in the blood, then she's not doesn't have enough glucose available, so then they're breaking down fat, and that could cause problems in the mom and the baby. So those are things that they would want to be checking for.
When do teratogens affect the fetus? So teratogens have the ability to affect the fetus during all stages of development, depending on the teratogen. Some teratogens only affect the fetus during specific stages of development. However, the fetus is most susceptible to teratogenic assault during the embryonic period, and this is because the embryonic period consists of organogenesis, which is the formation of organs. During this time, there could be a number of organ malformations due to teratogenic effects. The embryonic period. So weeks 1 and 2 consist of gastrulation in the embryonic period. Gastrulation is a process in which the 2-layer embryonic disc develops into a 3rd layer and a primitive gut. As you can see to the right, there is an illustration of gastrulation, and it is a blastula changing into a gastrula and the different layers developing. Weeks 3 and 4 of the embryonic period consist of the development of major structures for the nervous system and organ development. So during this time, you'll see the neural tube develop, and the heart will also start to form during this time and will begin forming throughout the 8 weeks of the embryonic period. Week 5 of the embryonic period consists of the inner neck and face formation. Arm buds start to appear. The inner ear starts forming, and the liver, pancreas, spleen, and gallbladder also begin to form. In week 6 of the embryonic period, we see the eyes, nose, some leg buds form, the hands start to form, the fetal stomach, and the precursor for the kidneys also begin forming. In week 7, we see the lungs, lymphatic system, primary sex organs, and the digits of the hands and feet, so fingers and toes start formation. In week 8, we see nipples, hair follicles, the external ear, and all the other essential organs begin formation. You can also note in week 8 that the fetal face begins to appear human-like, and the heartbeat and limb movement can be detected via ultrasound. So as you can see to the right, there is an illustration or a photograph of an embryo or a fetus at week 8 to 9. So this is after the embryonic period. You can see the development of all the things like fingers, toes, organs, facial features that we just discussed. And all of these features can be affected by teratogens during this period. With that in mind, and the major formation of many different organs that go on during this period, it's easy to understand why teratogens may be so harmful during this period specifically, and why the embryo is most vulnerable during this time.